Hello and welcome to Lyra Nara. You may already know that millions of people suffer from Lyme disease. But did you also know that Lyme disease often is associated and comes with serious co-infections that complicate the whole situation even further? Unfortunately, also those co-infections are difficult to detect with laboratory tests and also difficult to treat with traditional methods. Therefore, we thought it would be very interesting for you to talk about three of the main Lyme disease co-infections that you very often encounter and show you all the symptoms that you have to pay attention to, also how to detect them, and most importantly, we're going to propose to you a natural, side effect-free therapy protocol that really works. So, without further ado, let's learn more about Lyme disease co-infections and how to get rid of them naturally. And the three main Lyme disease co-infections that we are going to talk about in this presentation are Epstein-Barr virus, Mycoplasma, and Chlamydia. They are some of the most often encountered Lyme disease co-infections, and they have devastating effects if left untreated. These co-infections, as I've mentioned already, are unfortunately very difficult to detect with traditional laboratory tests, but we here at Lyra Nara offer you a remote, fast, reliable and affordable way of determining with a very high accuracy whether you suffer from any of those co-infections or actually any other type of pathogens or infection beside the Epstein-Barr, Mycoplasma and Chlamydia. I'm going to post a link in the description box below where you can get those tests done. And the good news is also that with the right natural supplements, herbal remedies, as well as bioenergetic treatment devices, you can address those conditions very successfully and without any side effects. And for that, we have prepared a unique line of HERBESO products that have been specifically developed to treat those conditions. They all contain ultra pure, extra purified DMSO that has been compounded very carefully and in the right proportions with the organic herbs that have been extracted according to our unique vivid extraction methods that increase bioactivity, and they all break biofilms for better absorption. And if you have similar symptoms than the ones we describe, but no clarity about the pathogens that cause you all the troubles, then call us or book a complete DNA scan. As I've mentioned, links are going to be in the description box below for you. So the first co-infection that we are going to talk about is Epstein-Barr virus. Epstein-Barr belongs to the family of Herpesviridae, and Herpesviridae are a very large family of viruses that cause numerous health conditions in humans, and they manifest with different symptoms. It's believed that over 90% of the population is infected by some type of Herpesviridae. Most frequent symptoms are CFS, encephalitis, herpes, shingles, migraines, cardiovascular conditions, as well as cancer, especially Hodgkin's and lupus. Herpesviridae are structurally characterized by so-called virions, which are virus particles with an outer protein surface and a lipid envelope that contains so-called glycoprotein spikes. And here are the different types of herpes viruses. First is the simplex virus, that has two subspecies, the oral herpes and genital herpes. Then we have the zoster virus, also known as varicella virus, has two subspecies as well, the varicella zoster virus, also known as chickenpox, and the herpes zoster, also known as shingles. Then we have the gamma herpesviridae. Again, here two subcategories, of which one is Epstein-Barr virus that we are going to talk about here in more detail. And then we also have Kaposi sarcoma associated herpes virus. And the fourth category are the so-called beta herpesviridae. And here we have three subcategories, the cytomegalovirus, CMV, the exanthum subitum virus, also known as roseola infantum, and the human herpes virus number 7. Which are the symptoms then of Epstein-Barr virus that you have to be on the lookout for? Well, initial symptoms are mild flu-like symptoms that you're going to encounter for about 3 to 5 days. Then you have the classic symptoms triad, which consists of fever in over 97% of the cases, and the fever will persist for 7 to 10 days, accompanied by severe sore throat and a prominent cervical lymphadenopathy. Other common symptoms are fatigue in 93% of the cases. It's very characteristic for Epstein-Barr virus. Also mitochondria damages, chills, malaise, myalgias, and headaches in 50% of the cases, often even strong migraines. And here is the unique HERBESO therapy protocol that we have developed specifically for Epstein-Barr. You need first HERBESO EBV antiviral, which is of course, like all HERBESO products, ultra pure DMSO pharmaceutical grade that has been compounded with organic herbs that have been purified and extracted according to our unique vivid extraction method for the highest bioactivity. 1 teaspoon, 6 times per day, 4 to 6 weeks. Also, you need HERBESO MIT. Of this, you take half a teaspoon 6 times per day for 4 to 6 weeks. It's meant to reduce the fatigue attacks due to the mitochondria and immune system damages. Then we also recommend that you take the HERBESO LLS. This is specific for liver and lymphatic system drainage and support. 1 teaspoon 3 times per day for 4 to 6 months. Also recommended is the HERBESO NPR. And this is meant to treat meningoencephalitis and stop the neuronal cell infection as well as boost the neuronal cell regeneration. 1 teaspoon 6 times per day for 4 to 6 weeks. We also strongly recommend that you apply galvanic therapy as well as laser therapy because all mutated cells are or tend to become non-polar, and the easiest way to repolarize those cells is galvanic therapy combined with laser therapy. I'm going to post, of course, the links to all of the HERBESO products as well as to some awesome galvanic therapy and laser therapy devices in the description box below for you. The second very often encountered co-infection with Lyme disease is chlamydia. Infections with Chlamydia trachomatis are among the most frequent cases actually of sexually transmitted diseases, as you might already know. And infections of the upper inner eyelid can lead to blindness, that's called a trachoma. And they are worldwide among the most frequently occurring ocular infections, with 140 million already infected and over 500 million at risk. Also, infections with Chlamydia pneumonia is a very common respiratory disease that can generate arteriosclerosis as well as lung cancer, COPD and asthma. Most chlamydia infections are also asymptomatic and thus go undiagnosed and untreated, which leads to chronic inflammation and irreversible tissue as well as organ pathology. And despite aggressive control efforts, Chlamydia trachomatis infections have continued to constitute a serious public risk. And chlamydia, as I've mentioned, is one of the very, very often encountered Lyme co-infections. That is, unfortunately, because it's difficult to detect, many times overseen. It is also found in houseflies, fleas, lice, and mites, which can transmit the disease as well. It's assumed that 100 million in the USA alone are asymptomatically infected with chlamydia. And in 2012, the CDC received 1.422 million of reports of chlamydia infections from 50 states plus Washington, D.C. And this was the largest number ever reported to the CDC. so the numbers are unfortunately even on the rise. And chlamydia are very unusual microorganisms. Initially, they were believed to be viruses, and thereafter they were reclassified as so-called gram-negative bacteria. Today, it is believed that these microorganisms are microparasites because their exterior wall is atypical for gram-negative bacteria, being hardier. Like many other Lyme co-infections, chlamydia reside inside the host cells, and they scavenge and live on the host nutrients. And the symptoms depend on the organs that have been affected by the chlamydia, so where it has found its domicile. There are 9 known species of chlamydia: Chlamydia trachomatis, Chlamydia pneumonia, Chlamydia muridarum, Chlamydia suis, abortus, pecorum, psittaci, felis, and caviar. And the first 5 of those are the species that infect humans. Most often you encounter, however, Chlamydia trachomatis and Chlamydia pneumonia. Cats and dogs, by the way, can also be infected with Chlamydia felis, and they can transmit this type of chlamydia also to us humans. As with other stealth pathogens, each chlamydia species creates numerous subspecies of themselves, which are called serovars. And Chlamydia trachomatis shows 19 serovars. Each manifests itself through different symptoms. They also share genetic material with each other. For example, Chlamydia trachomatis shares genetics with Chlamydia abortus. And chlamydia are ancient organisms and have played an extensive role in the evolution of other life forms. And like other parasitic microbes, they scavenge ATP from the host cells, and they cause therefore extreme fatigue, amongst other symptoms. Chlamydia proteins and genes appear to be the root of many, if not most, of the stealth pathogens that accompany Lyme disease. And genetic analysis have also found that amoeba infected with chlamydia bacteria are the oldest genus, followed by the plant chlamydia infection, then the animal infection, the newest one being the human infecting species. And chlamydia jumped on people a long time ago from cats, probably altering their genome, enabling them to utilize the humans as a primary reservoir. So let's talk about the general symptoms you have to be on the lookout for with chlamydia. Most chlamydia infections are of the Chlamydia trachomatis or Chlamydia pneumonia type, as I've mentioned already, followed by Chlamydia abortus and Chlamydia psittaci. More than 90% of the cervical infections in women and over 60% of the urethral infections in men are caused by chlamydia. And usually chlamydia infections are symptomatic for one or another chlamydia strain, like Chlamydia trachomatis, for example. It is considered specific for vaginal and cervix region problems. The Chlamydia pneumonia for respiratory organs, as the name already suggests. However, many other organs can be affected, such as the cardiovascular system, the connective tissue, especially the joints, the lymphatic system, and also the neurological system, leading to meningitis. Chlamydia are the most often identified pathogens that cause so-called reactive arthritis due to the Chlamydia trachomatis that resides in the synovial tissue, or oligoarthritis when the chlamydia synergistically works with the Borrelia bacteria. Chlamydia bacteria also create serovars or strains which regularly exchange DNA with each other, creating new varieties thereby. And when the membrane proteins change, the host immune system has trouble to identify those pathogens. And we cannot talk about all of the symptoms here in detail because, as I've mentioned already, each strain generates similar but also very different symptoms. And if you want to know about all of these conditions, you want to learn even more in depth about them, then we have specific presentations on all 3 of those conditions on our YouTube channel. Just search for them on our YouTube channel and you will find much more comprehensive presentations on all of those conditions. And here is the chlamydia therapy based on natural supplements and remedies that we propose. And the good news is that all chlamydia bacteria strains can be treated with the same basic protocol. And the same basic protocol addresses the following aspects. We have specifically developed a HERBESO chlamydia antibacterial, which again is ultra pure DMSO compounded with our organic purified antibacterial herbs that are specific for the chlamydia therapy, and they help you protect the Golgi structure from fragmentation. It also inhibits inflammatory responses in the macrophages. It has tonic effects in the spleen, liver, lungs, and the heart, and they reduce also the reinfection in deeper tissues. It normalizes also intestinal flora and restores the microbiome. We also recommend that you take HERBESO cytokine stop, which stops the cytokine cascade. Also vision care if you are suffering from chlamydia trachoma in the eyes. HERBESO membrane protector is highly recommended, which is for cellular membrane protection, which is a very important part of a successful chlamydia therapy. And also HERBESO MIT for mitochondrial and immune system boost. HERBESO LLS for lymphatic and liver support, and HERBESO immune booster to boost your immune system. And this therapy must be performed for a period of 6 to 8 weeks with all of the HERBESO products that are listed here. And with that, we come to the third major co-infection that can be encountered in Lyme disease patients, and that is mycoplasma. Mycoplasma bacteria are spread by biting insects such as ticks, mosquitoes, fleas, or biting flies, or sexual contact, or contaminated food, or airborne droplets. Everyone has been exposed to some form of mycoplasma in their lives. There are over 200 known types of mycoplasma that can infect both animals and plants. It is highly adaptable and can jump and adapt to new hosts very rapidly. There are at least 23 different varieties of mycoplasma that can infect us humans, and few of them are considered harmless normal flora, but some of them are very aggressive pathogens. For example, Mycoplasma fermentans, which was artificially designed actually by combining a Brucella bacteria nucleus with the Wisner virus. It was tested on inmates in Huntsville, Texas, in a prison with disastrous health effects in that region, of course. Dr. Charles Engel, who is with the U.S. Institute of Health in Maryland, stated, for example, on February 2007 the following, and I quote, "I am now of the view that a probable cause of CFS, fibromyalgia, AIDS, MS, and many other illnesses is the Mycoplasma infection. I have all the necessary documents to prove this. Most infected people are in the USA and few in Canada. Nowhere else this mycoplasma affected the population at the same extent." End quote. So let's talk about the symptoms of mycoplasma then. Those with chronic Lyme disease, they are quite familiar with the names such as Babesia, Bartonella, or Ehrlichia. Unfortunately, these are not the only co-infections seen in chronic Lyme patients. Mycoplasma co-infections are lesser known by patients and seemingly often overlooked by the doctors. It is, however, imperative to treat Lyme patients for mycoplasma infections as well. The symptoms of mycoplasma infections are highly variable, unspecific, and many times therefore easily overlooked. However, the following symptoms are very common for Lyme co-infections with mycoplasma: CFS, joint pain, headaches, intermittent fever, nausea, gastrointestinal problems, recurrent diarrhea, visual disturbances, memory loss, sleep disturbances, skin rashes, joint stiffness, depression, irritability, night sweats, concentration loss, muscle spasms, nervousness, anxiety, chest pain, breathing irregularities, balance problems, vertigo, light sensitivity, hair loss, urination and bladder problems, congestive heart failure, blood pressure abnormalities, lymph node pain and inflammation, persisting coughing, eye pain, floaters in the eyes, and wrongly, all of these symptoms are many times allocated to the Borrelia bacteria. However, the major cause often is the Mycoplasma co-infection. In North America, Mycoplasma fermentans and Mycoplasma pneumonia are predominant. In Europe, Mycoplasma hominis is prevalent. And generally, the majority of patients with CFS have a Mycoplasma infection. However, Lyme patients have an even stronger prevalence of Mycoplasma of 75%. Over 55% are infected with Mycoplasma fermentans and about 25% with Mycoplasma pneumonia. The rate of Lyme patients that are infected with Mycoplasma surpasses by far that of Bartonella, which is only at about 25 to 40%, and that of Babesia, which is at only 8 to 10%. And the good news is that people with a good immune system and a healthy lifestyle can deal with the Mycoplasma infections quite well, as long as they, of course, support their system so that it can work properly. And here is the Mycoplasma therapy protocol that we propose. Mycoplasma therapy is very complex and usually takes 6 to 8 months until all symptoms have subsided. The protocols can be varied considerably depending on the patient's immune state and major symptoms. And we do present in this video, therefore, only a starting point in Mycoplasma therapy, which must be customized to each patient's needs. The body needs to be bathed, so to speak, in counteractants to the Mycoplasma cytokine cascade and the membrane proteins for long enough time to turn the physiological condition around and to make the cellular environment unpleasant enough for the Mycoplasma population. And the treatment must address the following points. We must replace the nutrients that have been scavenged by the Mycoplasma. We must reduce the specific cytokine cascades that the Mycoplasma has initiated. We also need to boost the immune system and the mitochondria. We have to support and repair the organs and the neuronal cell damages, take care of specific symptoms, and support the lymphatic system and help with liver detoxification. And the basic protocol that we propose consists of the following. HERBESO Mycoplasma Antibacterial, or MAB for short, again a proprietary blend that you can only get at lyranara.me. It contains vivid artemisinin, compounded with other antibacterial specific herbs extracts that are very good for Mycoplasma. The dosage is 1 teaspoon 4 to 6 times per day for 8 weeks. Then also highly recommended is that you take the HERBESO Immune Booster, as the name suggests, to boost your immune system, 1 teaspoon 6 times per day for 8 weeks. Also the HERBESO MIT, Mitochondria Energy Boost, 1 teaspoon 6 times per day for 6 weeks. Also, you need to take the HERBESO LLS, which is for lymphatic and liver stimulation. 1 teaspoon here again for 3 times per day for 4 to 6 months. And last but not least, the HERBESO Cytokine Stop. Here, 1 to 6 grams of each herb in tincture, powder, or capsule form. And with that being said, I would like still to talk a little bit about diagnosis of those infections. Because the successful diagnosis of Epstein-Barr, chlamydia, as well as Mycoplasma infections is often very difficult, and there are no serological criteria for persistent infections that exist today. For example, chlamydia. Most accurate tests for the chlamydia strains are so-called nucleic acid amplification tests, or NAAT for short, of which polymerase chain reaction is just an example. This test, however, can lead many times to false negative results. Then we have the ELISA test, or enzyme-linked immunosorbent assay. It's a quick test, but unfortunately it's not sensitive or reliable, same as with an AAT. Then we have the DFA, or direct fluorescent antibody test. This is very similar to ELISA with the same restrictions and problems. Then we can have a bacteria culture test. This is problematic as well, as Campbell and Rosenfeld noted in 2014. Chlamydia cannot be cultured from the lungs, although the PCR test is positive. Invasive diagnostic procedures and tests within the reproductive tract have been found to exacerbate the chlamydia infections even. And for patients, this is the good news. We do offer DNA scans that are remotely done to identify with a very high accuracy chlamydia, Epstein-Barr virus, mycoplasma, and many other pathogens. And for doctors and professional healthcare givers, we highly recommend to use EDS testing. Here, one of the devices we highly recommend is Vistron with the Homopath software that can diagnose with very high accuracy chlamydia and many other pathogens. I'm going to post a link to the Vistron Homopath in the description box below, and where you need to go in order to enroll for the DNA scans to diagnose and detect your infections as well. And with all that being said, please do not hesitate to give us a call or contact us at shop@lyranara.com for personal advice and consultation on what is best for you, or if you have any questions about any of the subjects discussed in this presentation. We love to hear from you. Also, if you've enjoyed this presentation, please support our work by sharing, liking, and subscribing. And until next time, stay healthy.